Assalamu alaikum. In the previous lecture, we were doing the hormonal contraceptives in which we did the different type of oral pills which can be used for contraception. Now, in this lecture, we'll do the depot formulations. The depot formulations are highly effective and reversible and are long-acting, and only one single administration can last for several months and years. And usually they are of three types: injectable contraceptives, subdermal implants, and vaginal rings. Now, coming to injectable contraceptives, they are of two types: progesterone only injectables and your combined injectables. Now, progesterone only injectables or your progesterone only injectables are divided into further three types: the DMPA, which is the depot medroxyprogesterone acetate, which is also called Depo-Provera. Now, it was started using in 1960s. It consists of an intramuscular injection of 150 milligram, which is given in deep intramuscularly every 3 months, usually at the gluteus maximus. Now, it suppresses the ovulation and has indirect effect on the endometrium and has a direct action on the fallopian tubes and on the production of cervical mucus. It is very safe, effective and acceptable contraceptive, and its important point is that it does not affect lactation. Now, the side effects associated with Depo-Provera are that a female can gain weight, the menstrual cycle can be irregular, and prolonged infertility can occur after its use, and sometimes there can be amenorrhea as well. Now, second type of progesterone only injectables are NETN, which is nor ethisterone enanthate. It is an injection which is given intramuscularly. The dose is 200 milligram and it has to be given after every 60 days, means it has to be given after 2 months. And it is also given in the gluteus maximus as deep intramuscular injection. And the third is your DMPA SC 104 milligram. This is DMPA Depo Subcutaneous Provera, and it is injected under the skin. Like, it has to be given subcutaneously, not intramuscularly, and it is also given at an interval of 3 months, and it is given in the upper thigh or abdomen. Subdermal implants are Norplant R2, which are easy to insert and can be easily removed. They consist of small rods, and as you can see in this picture, like a matchstick, and they are placed under the skin of the arm or that of the forearm, and it provides contraception for 5 years. Now, the main disadvantage of this is that there is irregularity of the menstrual cycle, and surgical procedure is required to insert and remove these implants. And in the other picture, you can see Depo-Provera contraceptive injection. Now, the contraindications of usage of these contraceptives are that they should not be given if there is any cancer of genitalia, or there is a CA breast, or undiagnosed abnormal uterine bleeding, or suspected malignancy. And progesterone only injections should not be given if a female is hypertensive, or in any condition which is related to heart or the blood vessels, or if there is any disorder of the liver, stroke, DVT, that is deep vein thrombosis, and especially women who are breastfeeding a baby who is less than 6 weeks old should not be using progesterone only injectables. Now, the terminal methods or sterilization, it's well-established contraceptive procedures for the couples who do not want to have more children. And it is a one-time method and it's very effective. Now, it has very less side effects. Now, the guidelines for sterilization are very important, and they are, and this is a very important question which is given in SEQs as well. That what are the guidelines for sterilization, both in male and female. Now, the sterilization services are provided free of charge in the government institutions, and the various aspects are: number one, the age of the husband should not be less than 25 years, nor it should be above 50 years. And the age of the wife should not be less than 20 years or not more than 45 years. And the couple should be motivated and must have two living children at the time of operation. Fourth point is that if the couple has three or more living children and the lower limit of age of the husband or the wife, it can be relaxed, and it's according to the discretion of the operating surgeon. And next aspect is that it is sufficient if the acceptor declares having obtained the consent of his or her spouse to undergo sterilization operation without any outside pressure, and that she or he knows that for all practical purposes the operation which is done, it's irreversible, and also that the spouse has not been sterilized before. Male sterilization or vasectomy, it's a simple procedure which can be performed even at the primary health centers by trained doctors under local anesthesia under strict aseptic technique. And in vasectomy, what they do is they remove a piece of vas deferens at least 1 centimeter after clamping, and the ends are ligated and then folded back on themselves and sutured into a position so that the ends, they do not face each other, they are away from each other, and this is done to reduce the risk of recanalization at a later stage. Now, after the procedure, the client is told that he is not immediately sterile after the operation. Usually, approximately 30 ejaculations have to take place after he becomes steriles. And during that time period, he should be using other methods of contraception. And vasectomies are 100% effective methods of contraception. Now, there are certain complications which can arise after vasectomy. Number one is operative complications. Now, in the operative complications, they are very minute, like there can be pain or there can be scrotal hematoma and local infection. But if the aseptic measures are taken during the operation, very less chances are there. So it can only occur in 2 to 3% of the patient, and administration of antibiotics can reduce this risk. Now, the second is sperm granules. Now, sperm granules are caused by the accumulation of sperm, and it appears in the 10th to 14th day after the operation. Usually there is pain, swelling, and a hard mass is felt, which is 7 millimeter. Now this sperm granules can provide a medium through which the reanastomosis of the vas can occur. So usually there is a little bit of a risk, but it usually subsides on its own. And it has also been reported that if you use metal clips to close the vas, then the chances of forming sperm granules are very less. Next is spontaneous recanalization of the vase. The chances are very less, that is from 0 to 6%. Now, next complication is your autoimmune response. Now, after vasectomy, it is sometimes seen that there is autoimmune response to sperms, that there are antibodies produced against the sperm in the blood, but these are not harmful antibodies. Now, next is psychological effects. Now, psychologically, some men, they usually think there is loss of libido or there is impotency. There are complaints of headaches, fatigues, but that can be eliminated. Now, these are different complications which can occur after vasectomy. Now, coming to the causes of failure of vasectomy, the failure rate of vasectomy is very less, that is 0.15 per 100% years. And the commonest cause of failure is the mistaken identification of the vas deferens, that instead of vas deferens, some other structure in the spermatic cord, like a thrombosed vein, is cut and sutured. In some males, there can be more than one vas deferens present on one side. And sometimes the failure rate can occur that the pregnancy can result from intercourse because of the disappearance of sperm from the seminal fluid is not confirmed. So that's why it is said that after 30 ejaculations, the male becomes sterile. Until then, he should use some other methods of contraception. Now, next is the post-operative advice which has to be given to the patient. Now, the patient should be told that he is not sterile immediately after the operation. So, at least 30 ejaculations are necessary before the seminal fluid is negative of sperms. And until then, he should use contraceptives before aspermia has been established. Now he should avoid taking bath for at least 24 hours after the operation, and he should wear tight underwear or a scrotal support for at least 15 days, and to keep the site of the operation clean and dry. Now, the person should avoid cycling or lifting heavy weights for at least 15 days, and there is, however, no need for any complete bed rest. Now, he should come to the hospital or the primary health care wherever he has been operated for the removal of stitches on the fifth post-op day. I'm giving you a small assignment. You have to answer these four MCQs and submit your assignment by 12 o'clock today.